Hello everyone, welcome to Medical Mindshare. Myself, Dr. Yogeshwari. From today onward, I am going to start the pathology series on this channel. Generally, the BMS second year syllabus include the subject Rognidan, under which the pathology is being covered. In pathology, in the syllabus, there are the various of the disease given. But here I am starting the lecture of that disease from sciatica. In today's lecture, I will be discussing about the disease sciatica. So, we will first start with the general introduction of the disease sciatica. In Ayurveda, the sciatica is generally called as the Gudrasi. What is actually the sciatica disease? The sciatica is the disease generally caused due to the sciatica nerve. As you can see in the photograph given, what is actually the sciatica? In sciatica, there is a pain from the thigh or the buttock that is radiated towards the feet. Generally, this pain is caused due to the sciatica nerve. Generally, the sciatica is the disease of the lower extremities, that is, the pain of the sciatica nerve in the lower extremity from the thigh or the buttock to the foot. Etiology of the sciatica. Etiology means the causes. In that, the first one is disc herniation. Generally, the herniation means the bulging, means you know that in the vertebra column, in between the vertebrae, there is a disc. So, the bulging of the disc means the disc herniation. Generally, the cause of the sciatica is the disc herniation of the lumbosacral vertebrae. The most common question to arise is that why generally the specific lumbosacral vertebra disc herniation is the cause of sciatica. The very common answer to this question is that as we all know that the sciatica is the disease of lower extremity. So whatever the nerve that are supplied or originate for the function of the lower extremities are generally originated from the lumbosacral vertebra. The means lumbosacral vertebra spinal cord. Lumbosacral vertebra are the lowermost part of the vertebral column. In that also the specific L5 or S1 vertebra disc herniation is the main cause of the sciatica disease. As you can see in this photograph, generally how the disc herniation is causes the sciatica. Generally, due to the disc herniation, there is a compression of the spinal nerve, that is sciatica nerve, which leads to the pain along the spinal sciatica nerve, giving the symptom of the pain in your lower extremity. The second most important cause of the sciatica disease is spinal stenosis. What is a spinal stenosis? As in this photograph, you can see spinal stenosis means the gap between the two vertebrae is reduced. Due to the reduction in the gap between the two vertebrae, there is a compression of the spinal nerve, that is, the compression of the sciatica nerve, which causes the sciatica disease. The third important cause of the sciatica is spondylolisthesis. This is actually the displacement of the vertebral column either anteriorly or posteriorly, as you can see in the photograph. The other causes of the spinal sciatica nerve disease or sciatica are generally maybe there is a irritation of the nerve that may be caused from the adjacent bone or due to the internal bleeding, infection, tumor, or any other injury to your lumbosacral vertebra or any other causes. Sometimes you can see that in pregnant women, the, the pregnant woman also faces the problem of the sciatica. As whenever a lady is pregnant, in the phase of her pregnancy, as a fetus grows or the develop, there is a compression of the various organs that, that surrounds your uterus or they are adjacent to the uterus. There you can see the compression of that organ. So, due to the pregnancy, there is also somewhat compression is faced on the lumbosacral vertebra, and ultimately there is a compression of a spinal nerve which causes the sciatica for a short term during a pregnancy. Now, as we already seen, the etiology or the causes of the sciatica, in that the first one is disc herniation, the second one is spinal stenosis, the third one is spondylolisthesis, and there are the other causes also mentioned earlier. Now, heading towards the clinical features means the main sign and symptom of the disease sciatica, in that the first most important and the prominent sign of the sciatica is the pain. As in the beginning, I already told you how the pain of the sciatica is felt. Generally, there is a pain in your lower extremities from the buttock radiating towards the foot. The pain is generally felt when the patient tries to make any movement of his leg, and the pain is generally along the sciatica nerve. The pain of the sciatica gets worse or may increases when whenever the patient with the sciatica sneezes, cough, laugh, or whenever he will be having a hard bowel movement. At that time, there will be the increase of the pain in the sciatica. Whenever the patient with the sciatica tries to bend backward, there will be a sudden increase in the pain. In somewhat cases when the sciatica become worse. At that time, the patient is unable to move his foot, or the there is a weakness of the leg along with the pain. The second sign and symptom of the sciatica is numbness. The third one is walking difficulty. You can generally see that the patient with the sciatica feels the difficulty in walking as the patient is unable to walk properly. There will be a change in his gait or in her gait. Whenever he will try to walk or she will try to walk, there will be a pain, so he may not walk properly. Now, how you will investigate or diagnose the sciatica disease? Whenever the patient comes towards you with the history of or the complaint of the pain from the thighs toward the foot, whenever he walk, you will you will doubt for the sciatica, and to confirm it, you will undergo the following investigation. In that, there is a MRI, CT scan, and X-ray. In MRI and CT scan, you can easily see the spinal nerve compression, which, which will confirm the sciatica. In X-ray of the lumbosacral vertebra, you will see there is a disc herniation, spondylolisthesis, or the gap between the two vertebrae is being reduced, known as the spinal stenosis, and in this way you will confirm the sciatica. Now, treatment. In treatment, in starting, or the patient with not a severe condition, you will go for the medication, and in that medication, the first basic is a sciatica pain relief, which means to reduce the pain originated or produced due to the sciatica. For that, you will go for NSAID, that is non-steroidal anti-inflammatory drugs. In that means, in short, you will give them a pain relief. In that, there is ibuprofen, diclofenac, or you will the next step is you will go for the physiotherapy. In physiotherapy, there is prescribed some specific exercise or the movement that will help to lessen the pain of the sciatica. The third is muscle relaxant. You will prescribe some of the muscle relaxant to the patient. Second is surgery. When the patient gets severe, at that time you will go for the surgery. Or whenever the compression of the sciatica nerve is major or of high degree, at that time you will go for the surgery. Generally, in the sciatica, with the history or the cause of the herniated disc, in the surgery, whatever the part get herniated, it is removed. In this way, the patient get relief from the sciatica. In spinal stenosis, whatever the portion of the bone that is putting pressure on the sciatica nerve is being removed. In this way, we have discussed the treatment of the sciatica. Now, cauda equina syndrome. In as you know that the cauda equina, it is the lowermost part of the spinal cord, and the cauda equina syndrome is generally a neurological condition in which there is a acute loss of function of the lumbar flexes. It means generally the sciatica is felt in only one of the lower extremities, but whenever there will be the involvement of the both of the lower extremities, it is a sign of the quada equina syndrome. It is generally a bilateral sciatica. In this way, in this lecture, I have discussed the sciatica. In upcoming lecture, I will be discussing about the Ayurvedic correlation of the sciatica, that is Gudrasi, and in further lecture, I will be covering tetanus and convulsion. For more lecture of pathology, stay tuned to Medical Mindshare. Thanks for watching the video, and please do like, share and subscribe to Medical Mindshare.